out right now. It's pretty nice. It's actually probably the coolest day we've had in the last 2 to 3 weeks, but apparently you'd rather come spend it with me. So this is my second community event today. I've been stood in the field, so by the way, don't get too close to me. I've been standing out in the sun for the last 3 hours at Holgate School and doing another community event, just doing some free checks on people down at Holgate. This is our second event today, so thank you very much for attending. Can I just get a show of hands? Who's here for themselves? Okay, cool. Who's here for kids or family members or someone else? Okay, cool. So what I noticed on the last one of these that I did, so the first one I did, it was very kid heavy, like people really wanted information for their kids. The last one was a lot more adults wanting information for themselves. And so what I'm going to try and do is connect the dots so that everyone gets everything for everyone. Is that fair? Cool, because I understand it's not just kids that obviously struggle with these issues, but I have started working a lot with kiddos and seeing some really cool improvements. And I'm going to check them at the right talk. The dysregulated, neuroatypical, struggling with neurodevelopment talk. I've got that right? Dysregulation, dysregulated mind, stress, anxiety, brain. Cool. Amazing, so I'm at the right talk. So my name is Patrick. I am the lead chiropractor here at Complete Health. And probably this is the first question I'm going to obviously address. Why am I sat in a chiropractic physio massage office? Because that's often the first thing that people ask me when they are sitting in front of me, because I'm a chiropractor. What's a chiropractor got to do with ADHD or neurodevelopment or autism? And that's often the first question that people ask me. So let's just try and understand. What do people actually understand about a chiropractor first and foremost? What do chiropractors do? Realignment. Cool, which is what everyone thinks we do. Cool. Yeah, it's a valid.
And also what you
what we've got up on here. Nervous system, right? So look, this is the crux of it. I started. I ironically fell into talking about this stuff by accident. I went on a seminar with a really cool guy. His name is Tony Ebel. If you guys want to look him up, he's really cool. He works over in America. He came over and did a 2-hour, 3-hour seminar with me, and Andrew was actually there with me, talking about managing like neurodevelopment, especially in developing brains and kids, and the relation of how it is with spinal function and neurological function. So, interestingly, I was at one of my housemates' birthday parties, or one of my old housemates' birthday parties, and there was a couple there who had a son that had autism. He was non-verbal, or should I say non-speaking, we don't use non-verbal, it's non-speaking, autistic. So quite heavily autistic, he was about 7 or 8. Was having meltdowns all the time, huge sensory issues, like they couldn't take him to places like the beach because he didn't like the pebbles underneath his feet. He was having meltdowns at school, he was biting his teachers, like there was just behavioural issues, development issues and communication issues, right? 6 months down the line, and ironically, I'm really sad that I forgot to bring this, I got a card from the family, and the card is basically just put in all of the neural development changes that the kid has seen. He will now go to the beach, he'll sit on the beach. In fact, they're getting him closer and closer. I got a video the other day of him now standing next to, he won't get in the sea yet, but he's standing next to the sea, throwing pebbles into the sea, right? The teachers have noticed that his spelling is getting better at school. The teachers are noting he's communicating better at school. He will now walk down the beach without having to have the buggy. He will have less meltdowns. He will go to bed. He will. So the neural development we saw with him. Now I took this on as like a pro bono case because I wanted to see, does what we do have an impact on kids' development? And do you know what I saw? Yes. So look, what I want to try and do is go through in the next hour why we saw those changes, what is the development behind the brain, and how is it involved with what we do, so you can understand a little bit more about how we can actually manage neural development or neuroatypical findings. Is that cool? Is there anybody that doesn't want to know that? No, everyone in the room wants to know that? Cool. Good. Okay, perfect. So, like I say, obviously I studied as a chiropractor. I had to study for 5 years. So, primary things that we obviously have to understand: anatomy, which is why everyone thinks that we work on alignment, right? Because obviously, what do chiropractors always talk about? We always talk about the spine. Really, the importance of the spine is obviously the thing that sits inside of it. The real key thing that we talk about a lot at university is neurology, right? And this is the thing that most people are going to want to know the most about. Now, I reckon I actually learned more since I finished school than what I learned in school, right? You probably see this. How many people in the room have got kids, right? Kids academia, right? It's a bit like memorizing books and just kind of jumping through hoops and hurdles. So guess what? University, not far dissimilar. What they taught me at university was how not to kill my patients. Pretty good, right? That's probably the most important thing that I can learn, okay? So I actually think I've learned most of the stuff that I'm probably going to teach you today since I finished school, okay? Now, one of the things that I do just like to make people aware of, if I make you uncomfortable by doing this, just kind of like give me a sign. I like to ask questions, right? And the reason why I'll ask questions is that it typically keeps the room a little bit more engaged, right? So there has been a million studies done on this. They basically double-blind control studied this. You are going to learn way more if you're awake versus asleep. So if I ask questions, it's because I want to make sure that I haven't let anyone drift off yet. It's hot in here, so I want to make sure that everyone's obviously involved. Cool. So I think really, first point of call, the first thing I like to ask, because I think when we have symptoms or there's something that we're trying to solve, typically there's, I'm going to use the word loosely, something wrong. Is that okay to use that as like a terminology? Okay, so what I want to start with is like the point of what is ideal. If we ask what's the definition of health, how would we actually describe that? What would we, if we were to put that in the definition, what would we put it as?
Balanced neuro system.
Yeah, I think that's an ace from a chiropractor point of view. Yeah, I'd love it for everyone to say that to me. Yeah, balanced neuro system. Anything else?
Physical and mental health.
Physical and mental? Yeah, it's almost so close to the mark. There's one other one that the World Health Organization talked about. So I don't know whether everyone heard, that was like physical and mental balance. Physical and mental balance. When we actually look at the World Health Organization, they call it complete physical, mental and social well-being, and not just the absence of disease. So based on that terminology, complete physical, mental, social, not just absence of disease, how many people are actually healthy? Because how many of us are technically, at any one state in time, 100% socially, physically, and mentally well, right? So this is the thing, right? So when I'm teaching people about health, we have to understand it's like a sliding scale. We want to ideally try and be as close to the healthy end as we can possibly be. However, are there going to be times where we're going to potentially slide up and down that scale, right? Now, the reason why I talk about this is that there's something that's navigating this for us, right? And so this is where, obviously, like I say, I get really passionate about, and it's really nice when someone talks about that, is how our neurological system is involved with managing that function of sliding up and down that scale, okay? So let me ask another question. How do we actually measure people's health?
A lot of them by the reactions of the person.
So by symptoms?
BMI.
We can do stuff like BMI.
We can do blood tests.
We can do blood tests. Cool. Anything else?
Self-reporting.
Self-reporting, so we can do stuff like questionnaires and stuff like that.
Diary.
Diary. Cool. It's quite a lot of ways of measuring things.
Questionnaires.
Questionnaires. So there's a lot of ways, there's different ways of measuring it, right? For ADHD and autism and like neuroatypical behaviours, how many tests are there? It's not a lot, right? So it's typically done by what? Questionnaires and observations, right? And how objective is that?
Not very.
It's not very objective. It's a very subjective measure, and like if you give someone the same questionnaire on 2 different days, they're going to give slightly different answers, which will give you slightly different results.
And they're quite generic.
And they can be quite generic as well. So how many people in the room feel like they're getting kind of pushed and categorised, or their kids are getting pushed or categorised towards boxes, right? And if we look at it in other conditions as well, it's not just, by the way, ADHD, autism, or pretty much all other conditions that we go to. When you go to your doctor, right, and you have a problem, what is their first point of call? What do they do? Medications, right? What is the problem with medications?
Side effects.
Side effects, every single one, right? Every single drug we have on the market has a side effect. Some of them will be positive, some of them will be negative, all right? But pretty much every drug, even paracetamol, right, will have an impact on someone's liver. Long-term use of paracetamol increases someone's risk of having withdrawal headaches, right? So there's side effects to pretty much every medication that we have on the market. So when I started looking at things of how can we actually naturally, because most people sitting in front of me, how many of you guys want medications? How many of you don't want medications? Hence why there's a room full of people when I say naturally managing or looking at ways that we can naturally manage it, people are now looking for alternatives, right? I'm gonna be a little bit bold here. I think people are starting to lose a little bit of trust in their doctors. One, because they can't get an appointment. Two, when they get an appointment, does anybody ever really listen to you?
No.
And then three, like, we get the same result every time, and then all that ends up either happening is if you go back, you end up then getting pushed over to another prescription or a different prescription. And by the way, like, I don't blame doctors for this at all, because what do they study at school? Medicine. So what are they taught to teach, or what are they taught to give? Medicine. That's, and we get frustrated because we go into a doctor and we want a solution, but the thing that they studied was, I prescribed this for this problem. Does that make sense?
But nowadays they do referrals though for ADHD.
And they can
Right
do.
to choose.
Yeah,
because I
they-
work in
yeah,
surgery.
they can do. Yeah, they can do now. And that, I think, is actually probably one of the bigger positives, if we can get to that point.
Yeah.
And that's the problem, right? Is getting to that point. Cool. Sorry, I'm not going to diss the system too much. So, okay. So, look, for me, there are typically, most people when I talk to people will typically say, when we go measuring, and I think someone said this earlier, how we look and how we feel, or like the things that present, right? How many people in the room kind of sometimes feel a little bit closed off to the world, because people kind of say things like, oh no, like that's just like a fake diagnosis, or oh, you don't really seem that different, or you don't really struggle that much, or you know, if you just do it like this, it'd be much easier for you, right? Because how many people can actually see ADHD? How many people can actually see autism unless it's at the extreme scale? Like, how many people just go, oh well, that kid's just badly behaved? By the way, like, I love him to pieces, but one of the hardest kids I work with, Mikey, is like a whirlwind from start to finish when he walks into my office. However, watching his behaviour change and seeing how he's actually starting to gain some control on his outbursts is amazing. Like, he used to come in, you couldn't tell him no to anything. Like, no didn't mean anything to him, just now, like, so Mikey's got a huge habit of grabbing my beard. My fault, I know. But now we'll follow instructions when I say, no, that actually hurts, can you stop? Whereas before, you just hang off with it. In fact, one day, he hung onto it so hard, he went, and his hand slipped through, and he goes, it's not attached. And I was like, it really was, it really was. So, look, this is probably one of the main reasons why I got into doing what I do. In this picture, there's someone that's got a medical health condition, right? And I just want to see because I'm not going to give any detail as to what it is or who it is, but I want you guys to know I understand this. So if I was to ask who or what the condition was, can we see anything in the picture? I know I've missed you in the corner.
Question?
So can you see who has the health condition and what the health condition is in the picture? I know I'm being a bit facetious here, really.
It's the boy in the middle.
I mean, ironically, actually, yes. Ironically.
He's autistic.
He is. That's my brother. It's not the one that I was talking about though, but ironically,
It's the
you can see it in the
idol.
eyes. He has.
I
Well,
work
yeah.
in a special school.
He ironically is, and yes, he's not the one though. There was something else in that picture, but ironically, clever for you picking it up. So my brother is autistic. Anything else? Did anyone
So
forget
what was the
anything else?
question?
So
who,
there
who
is
has a
the
medical
benefit.
condition?
Yeah, I didn't.
I'll let you. I'll throw it around again.
What was
That's
that?
okay.
Who has a medical condition?
So who? Can you see who? Ironically, she picked one up, but that's very, very, very clever because that wasn't the one that I was talking about.
What about this one?
Yep. Okay. And what's the condition? No. No.
Well, it could be every person in the photo.
That's
Every
the
single
point.
person.
What was it?
Right. That's the point. So it was the lady on the left or right, whichever way you're reading it from. It's my left. It's probably your right. Which was my mum. My mum died of a terminal bowel tumour when she was 48. So the reason why I show you this is how many people in the room can see it. No one. And this is exactly the point, right? Is ADHD, autism spectrum disorders, like PDA, like all of these neuro conditions that people are struggling with, people cannot see it. They can only really experience it, and again, it's only really when people have spent time with someone actually, maybe you'll start picking up some of those behaviours. Does that make sense? So for me, I've got a passion in this because ironically, you're absolutely right. I've got a brother that's autistic. Fortunately, very functional within society. But I also had a background of something that really forced me to want to understand and study health as a concept, because unfortunately my mum got failed by the system as well because it didn't get picked up early enough and actually got treated as constipation as opposed to a bowel tumour. And so then 3, 4, 5 months down the line, it had already spread through the gastrointestinal tract and then it had metastasized, by which point it becomes very difficult to actually manage. So, here's where I think stuff gets a little bit interesting, because our brain is the thing that I focus on, which actually is good for you guys, because for most of you, you guys are going to get a little bit more than this, because when I'm talking to someone about headaches or back pain, it can sometimes be a little bit more difficult to pair the behaviour or the thing with the brain, right? Whereas when we look at neurobehaviour, the name's already pretty much done half the work for me because we know it's something to do with our nervous system. Cool. So our brain typically has 3 main functions when we look at the overall function of the body. When we look at the 3 main functions of the brain, what does it do?
Regulate the systems of the body.
Regulate. So that's the autonomic.
Motility, moving.
Movement. That's the other one. And sensory.
Perception.
Speech.
Yeah, cool, and those as well. Cool. So when we look at stuff like autonomic, this is all the stuff that, like you say, is automatically happening in the background. This is stuff like our heart rhythm and rate. This is stuff like our digestion, breathing rate, etc. We also had someone at the front said movement. So how I do this a lot. I won't sit still for the whole time you guys see me here. And then the last one was sensory information as well, right? And so when we look at stuff like sensory information, that's touch and feel, but that's also stuff like taste, smell, sight, ears, etc. Okay? And then someone said speech at the back. Speech is kind of a mixture, it's a weird one, because it's a motor pattern as well, but we're also using some level of sensory information because we obviously, when we're talking, we're communicating, and so we're taking information from the person in front of us, interpreting, and then motor skilling it back out again. Which is cool. So what happens when it goes wrong? Because that's the interesting thing, right? Because there's something neurologically happening that makes those processes difficult for some people, me included, by the way. Cool. So, there's typically, in my experience, 3 major things that I see have an impact on someone's brain function. Now, we talk about these as stresses on the body. Okay, in chiropractic we call them the 3 Cs. Okay, can anybody think of things that might happen to the body that might throw it out of balance?
Tension.
Sorry, tension,
Stress.
stress.
Hormones, like menopause, for example.
Okay, right, we're going to go through that one because that one comes after the stresses. Cool. Anything else?
Behaviour?
Behaviour. In what sense?
Of not being able to regulate yourself?
Okay, yeah, yes, kind of, because that would cause a stress. Yeah,
Sleep deprivation.
sleep deprivation,
Going back to these toxins, maybe?
toxins. Amazing, love that one.
Physical damage. Physical damage.
Physical damage. I love these, by the way. These are great. Like we pretty much nailed them already.
Different illnesses.
Yeah. Okay. So we can again. So diseases. So they create toxins in the body as well. Yeah. Pathogens. They'll create a toxic effect in the body.
Medication.
Medication can be a toxic as well. Cool. So ironically, like, so we can categorize all of those things that we just basically went through into 3 categories, right? So we said physical stresses. Okay. So traumas, falling down the stairs, car accidents, blah, 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 right? Actually, we can go slightly the other way as well. So we talk about traumas, accidents, falling down. We can also, nowadays, how many people sit behind a desk? That's a trauma, by the way. When you do it for 8 hours a day, 5 days a week, that's a trauma. And I'm going to go through and explain to you what that does to the brain, okay? The other one we said was toxins, I think it was you, and we said stuff like medication. So tension kind of comes in with the physical stuff, so when we have the falls, the accidents, injury again, and I'm gonna, and the traumas, but also stuff like the toxins and stuff like that do cause tension as well. And then we said stress, the emotional stuff.
I think that's the stress. I was thinking about harassment, sorry.
Harassment, same kind of thing. So when we have stuff like harassment, we then have heightened stress. So we call them thoughts. So things that happen like emotionally to us, traumas, some things that happen physically to us, and then toxins, so things that are chemically happening within the body.
Couldn't trauma also be like a psychological trauma?
Yes.
Like,
Yeah.
it's not always about
Yeah.
physical.
So that's why we call that the thought one.
Yeah.
So that comes under the emotion. So when we talk about thoughts, it's like the emotional aspect of things. And absolutely yes. And I'm going to try not to overwhelm because I love neurology. As you can probably already start to get a gather on this, like I get excited when I start getting into the rhythm of this because this stuff is super interesting when you start then looking at things like the prefrontal cortex. Anybody heard if I use a word like prefrontal cortex? Anybody know about that kind of stuff? Cool. Processing center of the brain, right? Anybody heard of the amygdala? Okay, short-term processing. Anybody heard of the hippocampus? Right, long-term processing. We see neurological wiring in these spaces with trauma, whether it's emotional, psychological trauma, chemical traumas, or physical. So, how early in someone's life can trauma occur?
Before birth.
Literally pre-birth, right? So in the state that we're in utero, in the womb, right? Mum is stressed to the high heavens. Mum had to go on some medication because she has preeclampsia, or high blood pressure or prenatal diabetes, so mum is under stress. She's on medication, or she's on a. Who gets those toxins that are in mum's blood? Baby. So how early can stresses happen? Pretty much from conception. Okay? The earliest trauma that can occur in a baby's life, birthing process. Literally, like, we've gone prenatal, but as life starts on the external part of the world, does anybody know what the rate of C-sections in the UK is right now? Yeah, does anyone who has a guess? 1 in more than 3. 33%. Roughly. So it used to, I can't remember, did you print those charts off? They are in the so by the way, the AI's got because I redid the chart and it's got my numbers wrong, but it's in here. It shows it from 78 being down at 9%. This one's supposed to say 33. I don't know why because it literally says like 29 here, and then it goes, the bar goes up and it says 25. But the point is that if you look at the curve as time's gone on, like literally the rates of C-sections have gone up, right? And I think, look, there's a couple of reasons why potentially that's going to happen. One, we've started to really medicalise the birthing process. Two, I think more people are opting for elective C-sections, right? So it's not just the fact that it's emergencies, people are electing to have C-sections. What happens to a baby during a C-section? Has anybody ever seen one? By the way, there's a photo of it in here again. Let me just take that off you again. Sorry, might as well just leave it this end. It's on the one? Oh no, it's not on there. Oh, don't worry about it. So they yank the baby out by its head.
Oh.
Right? So they cut open, pull it out. When you obviously come through the birth now, head compresses and re-expands. Now, the relevance on this, okay, so this is where potentially trauma starts and where we can then start to see changes in neural behaviour. Okay? So, if you yank a baby out by its head, baby doesn't have particularly good muscle tone. If you try and sit a baby up, what happens to its head? Okay? So muscle control is pretty poor. We agree? Cool. So you yank a baby out by its head, what's going to happen to the joints in its neck? It's going to get strain. Big time. Right? We can actually measure this, by the way. If you pull a baby out by its head and you strain a joint in the neck, do you think that joint's going to move particularly well?
No.
No. Right. So this is what happens. The term is called dyskinesis. Right? I'm going to break it down. Dys means not a lot of or lack of. Right? Kinematics means movement. Right? So basically, in simple language, you pull a baby out by its head, the bones stop moving properly. Okay? Now, the reason why this is a problem is, how do you think our brain understands how we move? Where does it get its understanding of movement from? Movement of the joints in our spine. Specifically, for balance and posture, where does it come from?
Messages.
Top of the neck, right? Yeah. And those signals from the top of the neck, they go, like you say, straight to the
Neural.
brain, right? So if I'm moving my head around, my brain goes, oh, head's going left, head's going right. Okay, I can use my postural stabilizers to not fall down, right? Now, what relevance does this have? Well, if there's no movement or the joints have been damaged in the neck, the signal into the brain then gets affected. The signal into the brain gets affected, the brain starts to get confused. We call this deafferentation. Afferentation just means signal into brain. Okay, the word afferent means arriving to the brain. Deafferentation again just means, again, the medical jargon made simple. D or dis or A means none of, like we've lost it. So if there's no signal into the brain gets confused, right? When a brain gets confused, do you think it's a happy brain or a sad brain?
Sad.
Simple, right? By the way, it is as simple as this, right? Is when the signals into the brain are not working properly, the brain gets stressed, right? So like I said, when we have traumas, whether they're physical, whether they're emotional, what happens is short term, they go into a part of our brain called the amygdala. And it sets off a what response? Stress response. Stress, good or bad. So what does this then do to the body, right? So we looked at this and we talked about autonomic function. This is where I think this stuff gets really juicy, okay? Because not only does this explain neural development issues or neuroatypical behaviors, this can also start to explain people's heart function, digestive function, all sorts of other functions that can get dysregulated from changes on neural motion, okay?
Does this explain like stonewalling in ADHD?
Stonewalling.
Stonewalling, just shutting down when you get challenged in a difficult situation.
So kind of, yeah, kind of. So there are things that again you'll see when, and I'll try and move on to this in a bit. So we have some measures that we can look at on that, and I'll explain those later. But when a system gets really overwhelmed, what's it going to do? So when we talk about the stress response, What's another like, what do people typically think?
Fight or
Fight or
Yeah.
flight. There's a third phase.
Yeah, because it's
Fight, flight, and
Freeze.
freeze. What do you just explain?
Yeah, and then I froze.
I've gone, and then you're like the rabbit in the, I can't do it.
Can I just ask something? Along with the cesarean and it being a traumatic physical thing,
Yep.
does it not also affect mentally? Because like mum and baby normally bond straight away, whereas mum's probably out of it and gets past her dad or nan or someone
What
else.
do you reckon?
Well, yeah.
Yeah. Right.
I heard also certain reflexes are
Mhm.
not being built if the baby is pulled out that way, because the baby has to go
Yep.
through the birth canal for
Yeah.
those.
Yeah.
That's why when baby gets
Certain
frightened,
reflexes. Yeah.
yeah,
There are other things that also happen, obviously coming through the birth canal, stuff like gut flora, also the compression on the head, expansion of the head, also kickstarts the respiratory centres. There's a lot of stuff that kickstarts when we come through the birth canal. The problem is, like, look, if there's an elective C-section, can we do something about it? Yeah. If there's an emergency C-section, can we do anything about it? No. We can just address the issue once we know it's there. Does that make sense? Cool. So let's look at autonomic function when a brain's under stress. If I started shouting at people in the room, because that's the kind of person I am, I'm just very irate and I just randomly flip tables and get really stressed. What happens to everyone's heart rate in the room? Cool. When someone gets anxious, what happens to your heart rate?
Increases.
Guess what? Brain function. What happens to people's breathing rate? Gets faster. Guess what? That's also, by the way, when people get anxious, what happens to their breathing? Dysregulation. Okay. Digestion. What happens to digestion under a stress response? You get that feeling in the tummy, like the gurgle feeling in the tummy. Does anybody actually know what happens to it? Does it work faster or slower? Slower. It freezes. Yeah. Gastrointestinal tract. So when you start looking at stress on the body, by the way, I do this talk with fibromyalgia as well, by the way, right? And when you look at this, and I get people to put their hands up in the room, right? Has anybody got kids that are diagnosed ADHD, autistic? Yeah, cool.
I'm autistic myself, and so is my son.
Fine. Okay. Food choices. Do you tend to find that there's some limitations on food choices?
Yeah.
Right? Because guess what their body can handle. And sensorily wise, there's a lot that only a few things that their body will let them go. There's a lot of stuff with stuff like taste, texture, but also the limited movement in the gut. They want foods that are typically easily digestible. Beige foods.
Yeah.
Why? Because they're easily digestible by the gut.
Beige food.
Beige foods.
Pasta,
So you tend to find
cheese.
pastas, maybe cheese, like
Yogurt.
cakes, biscuits, breads, but very plain. And again, there's normally a texture element with it as well. So some of them will like beige foods that are soft, some of them will like beige foods that are crunchy. It can fluctuate from person to person. It depends on their sensory processing. Okay, so the other one is, so if we had a look, and we said about this earlier, hormonal functions, right? So if we look at stuff like adrenaline, what happens to someone's adrenaline during a stress response? It goes up. Why? Because it's the thing that helps control stuff like our heart rhythm rate and breathing rate and stuff like that. Cortisol, what happens to cortisol? It goes up. Okay, what does cortisol do? It increases alertness. What does it do to someone's sleep? So again, if there's a dysregulated stressed brain, guess what the kids do? They go, and guess if you're an adult, guess what you get? Insomnia. So, by the way, you can just link all of this stuff straight back to the brain. And like I say, it pretty much starts with a stress. And again, it can be physical, it can be chemical, it can be emotional, right? So again, we can link this back again. Okay, so if we look at chemicals, what do chemicals typically do to the body? If we eat the wrong food, what do we normally expect to see in the body? A reaction, which is typically inflammation, right? Inflammation in the body, right? If we have inflamed joints, do you think those joints move well or do you think they move badly? Right. So what happens when the joint moves badly? We've already said, what does it do to the signal to the brain? Changes the signal to the brain. And then what happens to the brain? The brain gets stressed. And when the brain gets stressed, it changes the signal out to the body. Now, again, are all behaviours the same? None. Why? Because some people are going to affect certain tracts and other people are going to affect different tracts, right? There are different parts of our brain processing different behaviours, right? So when we look at stuff like autism, if we're going to go down, and again, I don't like labelling conditions, but when we look at the neural development of autism, typically what you'll find is left side of brain and right side of brain don't talk to each other very well. So we get a bit shut off from one side to the other. I don't know how many people have learned about stuff like this. One side of the brain is very literal. One side of the brain is a little bit more creative. When you tend to speak to autistic people, what do they tend to have more of? The
Creative.
sometimes
Literal.
a lot more literal.
Yeah.
My brother is very literal, right? And so, interestingly enough, when we've looked at neuroscan behaviours, when you adjust someone's spine, what you see is both sides of the prefrontal cortex light up by about 20%. Now, if I asked you to write in a notepad, do you know how much that would increase your prefrontal cortex behaviour by?
8.
1%. 1%. If you write in a notepad, that uses 1% of your prefrontal cortex. Do an adjustment on someone's spine, it uses 20% on both sides of the prefrontal cortex. Massive. Now the problem that obviously, like I say, autistic people have is they struggle to connect two sides of the brain. If you're getting both sides of the brain light up together, has anybody ever heard the saying, nerves that fire together wire together? Anybody ever heard that saying before?
Yep.
So when we look at, say for example, something like playing the guitar, when you first play the guitar, is it easy getting your fingers in the right position? Now the more that you do that and you connect those nerves in your brain together, the easier it becomes. Now let's just say you put down the guitar for 6 months, you don't play it, and then you pick it back up again. Is it as easy when you first put it down again? Be a little bit rusty, be a little bit ropey. Do you learn quicker the second time?
Yeah.
Why? Because those nerve pathways are already present. Those nerve pathways are already present. So, like I say, if we put toxins into the body and we start changing, we'll get inflammation. If we get inflammation, it will get irritation. It will go change the signals into the brain. Brain will start to get stressed. Signals coming back out again. We start to dysregulate, and like I say, those symptoms will change. We can look at the same thing emotionally, okay? Because we said about tension. When someone is emotionally stressed, what do you tend to notice happens with your muscle tension? Tenses up, right? Now again, neurologically, we can explain why. Hypothetically, there's a tiger at Drusilla's. I know there isn't one, because as far as I know, I've researched this and he's not there. But there's a tiger at Drusilla's, and he walks all the way down the A27, and he sees a room with 20 people in it, and he goes, "Oh, lunch." And he walks through the door, and he wants to come in, and he's going to eat everyone, right? We all have that stress response. We agree?
Yeah.
And if you don't, you'll freeze, and you can stay here, and we're all going to get out of there. But the point is that in that situation, do you think your muscle tone going up and preparing yourself to run as fast as you possibly can is useful?
Yes.
Yes.
Right, in the situation we're having an argument with our spouse, unfortunately, our muscle tone is doing exactly the same thing. Okay? Is it technically beneficial? Yes. Because if we needed to fight or flee from our spouse, which I'm hoping doesn't ever have to happen, but the reality is your brain is primitive. It's designed to survive. That's what it does. Survive or thrive. They're the two things. But when we're in those situations, our brain is way more interested in surviving than thriving. Because if there's a danger or a threat in front of us, it's going to survive first. Does that make sense? Okay? Muscle tension going up due to emotional stresses, do you think your spinal segments move very well? No. So what does it do? It causes the thing that we already said earlier, dyskinesis, which is a lack of movement in the spine, which then causes deafferentation, so lack of signal into brain, which causes stress brain, and if we want to give that a name, we call it dysautonomia. Dysautonomia basically means lack of control or good control on this. And what happens? We get stuck in a stressed state, fight and flight. Now this is where it's really important in neural development, right? Our brain or our body cannot be in fight and flight and rest and repair at the same time. Can't do it. Physically impossible. It has to be one or the other, right? Has anybody ever heard of something called the vagus nerve?
Yes.
Cool. What does the vagus nerve do?
the vagus nerve, for example, well, maybe I know it from my system, for
Yep.
example, with the guts
Yep.
and things like that. So
Controls the gut. So we talked about, obviously, all the stress responses. Guess what the vagus nerve does? It does the rest responses. Rest responses. So it's our parasympathetic. Okay. Like I say, if someone's been stuck in a state of stress for a really long time, we want to try and switch your vagus nerve on. Why? Because it's the brake. So if we think about obviously our sympathetic, our stress responses is the accelerator. By the way, I've put a little visual chart for this in your like packs, which is this one. Okay. And this is basically what I've just explained to you for the last half an hour, I think, half an hour, which is traumas, toxins, thoughts. Put on the gas, right? So we start to see a lot of the things that we're talking about around the bottom, right? Obviously, our emphasis today is on neural development, but the brake can work, and you can't have your foot on the gas and the brake at the same time. Does that make sense?
Yeah.
Right? So what we ideally want to do is yank your foot off of the accelerator and jam it down on the brake, just so that people's bodies can start to have a little bit more of rest, repair, and recuperation. Right? It's, by the way, I don't think this is huge rocket science. This is just neural development. Okay. So when we start looking, obviously, if the brain is constantly stuck on a state of stress, like I say, some of the things that we're going to start to see: hyperarousal, increased sensitivity. We might start to see with people's behaviours when their nervous system isn't cooperating properly and the information running in isn't working, the information running out doesn't work. We talked about it on an autonomic point of view, so organ function, but that signal going in is also reliant on the signals coming out to things like our muscles.
So,
Yeah.
when you talk about muscles, so I used to have epilepsy.
Yep.
And would that have anything effect to do with anything?
Honest answer?
Yeah.
Don't know.
You don't know.
Don't know.
No.
Like, because I always give honest answers.
Yeah.
So, could it?
Because I don't get given much information from neurology.
Because people probably don't understand it
departments.
particularly well, right?
Mm.
So epilepsy is one of those things. I mean, obviously when I studied it, it was at college, they used to cut your brain in half, right? And the reason being is that if they cut the brain in half and they changed the way that the sides of the brain talk to each other, essentially it shut out the epileptic seizures. But it also meant that if you covered one eye, people couldn't, they could see the shape on the page, but they couldn't tell you what colour it was. If they coloured the other eye, they'd be able to tell you what colour the shape was, but they couldn't tell you what shape it was. So the two sides of the brain, this is what we're saying, that you have the creative side and then you have the literal side, and when you split the brain down the middle, what ended up happening is people's brains started getting confused. Yeah. So they don't do that anymore, ironically. Yeah. But will there be a definite neural changes there? Because if they cut the brain in half and they sort of just cut the epilepsy, but it changed then their processing, is there going to be some sort of neural issue there? Or a neuro communication issue there? More than likely. More than likely. Cool. That's the best that I can probably answer that for you
Yeah,
today.
no, it's.
may I ask, when you talk on trauma and stuff, there's also a big one, post-traumatic stress disorder as well.
Yeah, so
It's a major one.
that would go under those emotional stresses,
Yeah.
or those thought stresses. So in the same sense of, and so just to be clear on this, you can get major stresses in all three of those categories. So post-traumatic stress probably being the most extreme end of the spectrum. So e.g., like when I work a lot with people like fibromyalgia cases, sexual domestic violence,
Or
physical
post-war
abuse,
veterans.
post-war, big car accidents where they've rolled it down a bank into a river or something, like something big. And then you can get micro stresses. So, you know, your partner just annoys you every day, like every day. It's a little stress, but one of them's like having a rock put in your rucksack,
You hit your
and
toe.
one of them's like putting a pebble in the rucksack. The point is, 1,000 pebbles can be as much as a rock.
I've had some pretty unhelpful feedback from people saying that ADHD and the symptoms of trauma response
Mhm.
are so closely aligned that they can't tell the difference, and it's maybe not real.
I mean, it depends on what your interpretation of it is. I can't agree or disagree with the statement. I think personally, based on what we've been talking about here, is there a trauma that's involved with most things? Yes. To say that one isn't triggering another, and again for me, ADHD and autism, dyslexia, they're kind of labels of the thing that or the outcome we see of a processing information. So personally, I would call it neurodysfunction in all cases. I don't like to label them into particular categories. You see certain patterns of behaviours based on different neural tracks. Does that make sense? So, but the trauma is the kind of prerequisite that probably kickstarts the neurosystem into those stress responses that then develop the symptoms. And how they present is going to differ from what you might say to me to the gentleman at the back might say to me to what the lady at the front might say to me. Does that make sense?
Yes.
Can I ask a question?
Yeah.
OCD as well.
Yeah.
OCD is a category, repetitive
Yeah.
things and stuff. Would that come into that between, sometimes you don't know between OCD, the autistic side and ADHD?
So it's the same answer I'm going to give you that I just gave to the last
Same, it's
gentleman.
neuro.
It's a neural development issue. Like I say, for me, how many? Okay, so just run a few statistics, right? So 40% of kids, boys, that are diagnosed with ADHD are also going to get diagnosed with what? Why? Because they're neural development issues. 40% of boys are normally easier to diagnose.
And also, there's a crossover, isn't there? It doesn't. Along with the children not fitting neatly in boxes, neither do the diagnosis. There can be crossovers in
There's
the diagnosis.
huge crossovers. However, like for me, I'm not hugely caught up on diagnoses because, again, the thing I'm not treating is the diagnosis. The thing that I'm treating
It's
or managing is the way that the neural development works, right? So, and this is then how we flip it. Because, by the way, we can measure how people's neurosystem works, right? There are ways of measuring neural function. Who knew, right? So I've got a few different ways of managing or looking at neurofunction. One, I think Andrea has a couple of like handouts. So we spoke about like lacking of movement and how it starts to have an impact on like brain signals in. What happens when brain signals in don't work properly? Brain signals to stuff like our muscle function doesn't typically work very well. You can take one. So what you'll see is if the signal into the brain isn't working particularly well, the brain loses spatial awareness, right? So when you look at those pictures of the way that those people stand, you'll notice that they don't stand very well in the first pictures, right? What you'll notice is then when I take the re-photos, when guess what? Their spine is moving better, look what happens to their spatial awareness. Their spatial awareness goes from this being, I'm standing upright, by the way, their brain just can't deal with gravity because it can't sensorily perceive it, to, oh, holy shit, my spine does work. I can perceive where I am, is one measure, right? What other measurements do I have? This is super cool. By the way, this is super new in the practice, and I'm really excited to start doing this. I can measure to see how stressed your heart is. It's really cool, okay? So we can have a look at heart rate fluctuations, right? So why would I want to know what your heart rate rhythm is doing, right? So heart rate and rhythm is related to either parasympathetic or sympathetic. It also shows us how much reserve someone's got in the tank, okay? So when you look at it on a bar chart, is someone in a stress response, is someone in an under stress response, or are they ideal down the middle? Have they got no reserve or lots of reserve, right? Ideally, what we want to be is spot bang in the middle at the top, right? Why? Because we want to have a lot of reserve. Why? Because it means that we can rest, restore, heal, etc. What we also want to be is balanced between our stress responses and our parasympathetics. Why? It means that if we go into a stress response, we can bring ourselves back into a repair response afterwards. If we're stuck in sympathetic or right down in the parasympathetic, we can't thrive in either end. We thrive when we can balance between the two. Does that make sense? What we do is we do a 3-minute measurement of how your heart is functioning, and it will tell us whether you're super stressed, whether you've got any reserve. We can also have a look at how well your brain distributes energy across the spine. 2 different ways, right? Electrical signals from your brain to your muscle function. We've already said, right, if you yank a baby out, what's going to happen to its muscle function or tissue function around the spine? It's going to change, right? Typically, from the age of 3 and above, we can test muscle electricity down the side of the spine. If someone's got huge amounts of electricity coming up at one point in their muscle, and very low electricity coming on the other side, we might start to see when we do the posture exams, stuff like this.
Have you noticed an increase with the use of mobile phones and the
What do
posture?
you reckon? What do you reckon?
Yeah.
You're right, you know the answers to these things.
Yeah.
Like the reality is, right, is, have I said anything today that people probably, it's none of the stuff that I'm saying is outlandish, right? None of the stuff that I'm teaching anybody isn't stuff that we've learned in physiology. There's just a little bit more depth and application to it, right? That's all I'm doing, is I'm applying the sciences that most of us learned this stuff when we were in secondary school, in our science lessons. We did this in biology, we just never applied it. And so they taught me this at university. What they didn't teach me is how to apply it to you and say, this person's having these responses, these symptoms, this is how we relate it back to your spine. And so for me, I was like, okay, so how do I relate this back to these conditions, and then these conditions, and then these conditions, and then these conditions? Because when you relate it all back, what's the common factor that pretty much all conditions have in common? It all starts with signals coming from the brain to the target tissue. And if there's a stress between the brain and the target tissue, we start to see a change. And like you say, there's 2 stresses that come from this. One, the stress physically, but also, what are you typically doing when you're sitting there scrolling on your phone? You're scrolling through what? TikTok or social media. What does social media do to our kids' brains? Anybody know?
Disturbs their attention.
It disturbs their, okay, so here's the key thing, right? Disturbs their attention. The question is why, right? So when we scroll through TikTok, what hormone are we looking to increase in our brain? Dopamine, right? So what are they looking for? They're looking for that. Typically, if you've got ADHD kids and they're sitting scrolling all the time, they are going to be keen dopamine miners, right? There are other things that as they start getting older, like ADHDers, are much more likely to become substance abusers, because again, it's dopamine fixes. It's feeding those dopamine receptors.
You mentioned the desk bit, that was
Yep. Yep.
Because I was thinking about
Yeah.
crouching. So I want to
Yeah, cool. So, okay, desk-based posture, right? Okay, so if we're in a desk, the key word I used earlier was dyskinesis, right? Lack of movement. Do you think sitting in a desk causes good movement of the spine or poor movement of the spine?
Your curvature.
Poor movement of the spine. So it increases the risk of what we call dyskinesis, which causes deafferentation or change of signal into the brain, which causes stress brain response, signals back down again, which then starts changing muscle tone response, autonomic dysfunction, and then again we can start to see sensory processing changes as well. Because like I say, our brain relies on information running in and then information running back out again. Does that make sense? Cool. Awesome. And yes, by and large, then that starts increasing stuff like your muscle tension, tone, and stuff around your neck and shoulders. Because look, the brain is designed to, like we said earlier, survive. So it will do anything it possibly can to stabilize it. This is the reason why I want scans, right? Because I want you guys to be able to see what I see, right? It's all well and good. I can sit and look at probably most people's posture in the room and go, okay, I can see that C7's rotated, or that person's tilting their pelvis forward. But can you see that when I tell you it? No. So this is the reason why I have measurements that show you stuff. This is the reason why I want to show people their posture photos, so that they can see what I see, right? This is the reason why we want to do stuff like heart measurements. Why? So you can see what I know, right? This is the reason why we want to do muscle activity, so you guys can see how your brain is controlling your, or lack of control you guys have got. Surface thermography, again, how well is your brain distributing energy across your body? Because if it's not distributing it very well, guess what? Certain things are going to get too much energy, certain things are not getting enough energy, and by the way, for a balanced system, is that going to be any good? No, because we want everything to work together. Does that make relative sense?
Yes.
Cool. The other thing we also do, by the way, if the body's been under stress for a really long period of time, you know, we start to see physical changes, we start to see neuro changes, we can actually also start to see structural changes as well, right? So we start to see things like changes on X-ray. So we might start to see degeneration. Again, if there's degeneration, that literally the disc is collapsing. Do you think that's going to do particularly good for the nerve signal? No. So again, there are so many ways. And what I'm trying to do is expand the number of ways that I can measure and help you guys understand what I understand. Does that make relative sense?
Yeah.
Cool. I've just gone blur, verbal diarrhea for like 45 minutes to you. How many people's brains are fried? Has it been a bit of information overload? No? Oh, dude, you guys are awesome. Because, by the way, you probably now understand more about chiropractic than half the chiropractic profession. Like, you understand more about what we do. Like, the number of clinics that I walk into with chiropractors that I go and have an adjustment with, right? And the way that they explain it and the way that they describe it, like, they're half right. What they forget is that when we're moving a bone and we're improving function of the spine, yes, does it help someone with their back pain? But the thing that they always forget to talk to people about is the way that it affects their brain. And that's the key thing, because even with back pain, when you move a joint, we change that signal into the brain so the brain can repair the tissue around the low back. That's all that's happening, right? So when we look at stuff like neural development, the same thing, right? All we're doing is changing those signals to and from the brain so that the brain can perceive the environment easier, so that we can sense information in easier, but also send signals back out easier so that we can control and process information better.
Does acupuncture work in the same way?
To some extent.
You're asking a chiropractor to advertise another service? I'll be honest, right? I'll be honest. I'll be honest. I don't know, because ironically I've not studied acupuncture, so
But I
maybe.
think it affects the brain, I thought.
Maybe, I don't know. I don't stick
I've
needles in
had it
people.
done acupuncture myself. To
Yep.
a certain extent,
Yep.
it helps, not 100%.
Yeah, and so this is the thing, right? Is that so we obviously believe in a multimodal model, right? So you're sitting in a, I'd say, chiropractic office. It's not just a chiropractic office. We do massage. We do have therapists here that do dry needling, which is like acupuncture, but when you look at traditional acupuncture and dry needling, they're slightly different. So dry needling is more to help with relaxation and stuff like muscle function. So they're slightly different perspectives. So like acupuncture, from my limited understanding, uses meridian points. So they will put needles in a very specific line on the body to deal with certain conditions. For me, stuff like that feels like cookie cutter techniques, right? So if you're saying you've got these symptoms, this is your line of needles, there's no specific care plan to the person. Whereas what I want to do is I want to go, okay, what can I scan? What can I see? What objectively can we see that I want to work on that this person's body says, this is where my problem is. So rather than just going, okay, this is what the symptoms say, I'm going to follow the same pattern with all people that tell me you have those symptoms. Does that make sense?
Yeah, yeah.
So it's the best I can answer that.
Yeah, I'm not too good at it.
Cool. Okay. Cool. I am just very aware of stuff like timing. Is it okay? Can you pass my phone over? Is it okay if I just share a review from one of our patients? Is that okay? Cool. So, has anybody got any preference? Like, should we flip a coin? Albie or Bowden? Bowden. Okay, cool. So Bowden, ironically, was the one that I was talking to you about earlier. So Bowden was the one that I said to you, whose parents I met at a birthday party. This is what they've had to say about Bowden's improvements since he's been in practice.
And I just wanted to ask him just a little bit about his experience. So Tom's been bringing Bowden, his son, into the practice, and I just wanted you to just explain a couple of things that you've noticed that you've seen change since he's been coming in.
Yeah, absolutely. Well, they've all been positives. You know, he's a lot happier, he's a lot more smiley, he's more relaxed. He's there just seems to be an energy around him that's just calmer, and also at school they've noticed that his concentration's improved, and he's now in a position where he can't write, but he can spell when he can read, and also other things like swimming with less aids, and they're able to walk without a buggy now and things like that. So those are real positives since going on this journey with him.
And I've noticed one of this, as you said about sensory stuff as well. One of the things that I know he doesn't like, but he'll now do, is sit on the beach as well.
Yeah,
Yeah,
absolutely.
Before. And things like the stroller.
Yeah.
You wouldn't really like going anywhere without a stroller. You can go places now without a stroller as well.
Yeah, he points to the boot and he wants the stroller now. So if he doesn't point to the boot, we now know, right, okay, we can crack on without it. So we're able to walk around supermarkets on a busy Sunday and things like that without it. And he's good as gold. He's able to follow instructions and hold hands. And especially at the beach, he used to hate the pebbles under his feet. And now he's able to walk out there, throw stones in the sea and stuff like that. So it's all good fun.
And in what kind of time frame are we talking about?
This is so funny, you didn't know.
1 bit, 5 months, something like that, 4.5, 5 months.
Probably from how many of us, like 6 or 7.
Yeah.
It's not actually necessarily been a hugely long time. And also, just for context, how many of you, so there's you, Bowden, and your partner, how many of you are actually under chiropractic care now?
All three.
So we just like the evidence to
So ironically, obviously, Tom initially brought in Bowden, which is, like I say, I took Bowden on as a case study for me to just learn. And ironically, because they saw such quick improvements with Bowden, guess what happened to Mum and Dad? They both booked in with them to go on the same journey, because they saw such incredible changes with them. They were having issues themselves, and they went, hang on, this works for him this way. Actually, we want to know a little bit more about that.
And for the and that 4.5 months, what was the frequency of the treatments?
Oh, good question. It's going to vary massively. So
For him,
for Bowden, okay, I saw him twice a week for 3 months. Twice a week for 3 months, and then I've seen him once a week. His dad came to see me, so his dad's neurology was less complex, because it was like a low back sprain strain. He was twice a week for 6 weeks, and then once a week then after, and actually we're now seeing him every 2 weeks. Yeah, but there's a different contrast. So this is the thing, is care.
are you still
management.
seeing him? Is there
Bowden,
maintenance?
Yeah, Bowden I'm still seeing on a regular basis. Parents like, just keep doing what you're doing. With parents, I'm seeing them less and less frequent. Yeah, because again, their bodies are balancing. When we do stuff like the neuroscan, like they're balancing. So when we do stuff like the posture examinations, re-examinations, their tissue, their system is now starting to balance, whereas Bowden's is still showing heightened stress. So, and again, we follow what the systems say, so that I can be objective and go, well, look, your neuro system is saying it still wants this, rather than me going, I want to see you this because I think that's what's best. We follow what the neurology says. Does that make sense? So we can be a bit more objective.
So, what age can you start from?
I mean,
Not you.
The youngest patient I currently have is 4 months old. Okay, the oldest patient I currently have is 87. Currently, the oldest I've had is 94.
Would be fine at 3.
Yeah. So from 3 upwards, you can do all neuro scanning with them. Like 3 and below 3, you can't do EMG because their postural stabilizers haven't kicked in yet. But you can do everything else.
So how much does